exercise. We are also going to talk a little bit about birthing prep, and so I'm going to do it with things that you're using first, but I will also show you the version with this size ball. What does this mean? That was extra. Okay, so in this position, we've got two bolsters stacked up. I kind of have my feet just a little bit outside of my knees, if I can help it. Just a nice little stretch, internal rotation, which we need. And what I'm going to have you do for starters is just place your hands at the base of your belly. We are going to breathe in through the nose and out through the mouth. And as we're doing this, I am trying to actively expand as I breathe in. So I should feel just a slight expansion and an increased pressure into the bolsters, through the vagina, through the posterior wall. And then as I breathe out, I'm trying to lift everything pretty much up. So again, taking a deep breath into my nose, hands on the belly, letting everything drop, breath out, letting everything lift. So once we've done a couple of repetitions of just kind of getting into that typical normal cycle, then we want to experiment with breathing for labor. And what this means is, contrary to what I just taught you, we breathe in and relax, we breathe out, and we increase pressure down. Now the only context where we're going to do this is going to be within the context of labor, and then also when you're pooping. So we also talked about using any times you're having to poop as an opportunity to practice exhaling and giving just a little bit of light pressure down to help you with that task. We also talked about placing the hands on the belly and feeling for the difference in the position of the belly as you're breathing out. So when I breathe in, I feel my belly expand down. As I breathe out, I'm feeling it kind of get lower. And that is what we're going to look to feel if for some reason with your epidural, you lose direct voluntary control of your vaginal muscles. In that case, you can use pressure changes that you're feeling in the belly to help you know whether or not you're pushing. So that is our exercise. The only difference is that if you want, sometimes the more slightly smushy surface of the ball gives you just a little more